This is David. He's 65 years old. He's been a patient of mine for 8.5 years, and he's been on testosterone replacement therapy for a little over 2 years. So why don't we go into what was wrong with you before you started on testosterone? What had happened to you? What kind of man were you?
Well, in my early years, I was actually a supposedly normal male. I did everything that normal males of 20, 30, 40, 50 years old
And
do.
when did it start to stop and change?
As I approached 50, 51, 52, 53, I was on a skateboard, downhill.
Downhill.
And it kept on multiplying, increasing and increasing and increasing. And finally, I hit the basement.
Well, let's talk about how you were in regard to the physical parameters. How was your strength? How was your energy?
There was no energy.
No energy.
I was constantly tired. I was physically tired, emotionally tired, and socially tired.
And your physical strength?
At that time?
Yeah.
Was very sluggish.
Very sluggish. Were you having any mental problems?
I wasn't depressed
Okay.
or anything like that. I didn't have those kind of mental problems. But I did have some social problems
Such
that
as?
derived from my behavior.
Well, in what sense do you mean your behavior? What was
My
wrong with your
lack of-
behavior?
Well, I'm married. I have 3 boys and 2 grandchildren, all boys, and a dog. And my interest at one time with my family was extremely high. I was constantly involved, and then at a certain point, my associations just decreased by the day, to the point that there was no associations.
Did the other members of the family notice this? Did they comment on
Constantly.
it? Constantly. What about your sexual life at that time?
Very poor. I was a very sexually active person up until I was in my early 50s. And then as I passed 52, 53, 54, it went from 100 down to 0.
Your libido? Gone?
Zippo.
Zippo. There were other factors also before we started testosterone. You're an insulin-dependent diabetic.
That's correct.
And you were having a problem with your weight and your diabetes at that
It was
time.
uncontrolled.
Both.
That's correct.
You had tried to lose weight for a while and it wasn't
Impossible.
impossible.
Whatever I did, I tried everything. From Jenny Craig to zoology. It just didn't happen. No matter what I ate, the body just wasn't burning it up.
So you would say that you were on this down slope for about 10 years before you started on testosterone?
Close to it.
Close to 10 years. Okay, then we did a testosterone level on you. It came back very low, which wasn't surprising because I believe that every type 2 diabetic is testosterone deficient. I haven't found one yet that wasn't. And your testosterone level came back very low. We started you on testosterone replacement, and what happened? Let's start with the physical, with the strength and the energy.
It was a 180-degree turn. And I mean 180 degrees. I went from a 0 to a 99. Not 100. Nobody's perfect at everything.
Okay.
But I started going out again. I was driving without any problems. I was going to different places. My family and I, we went on a variety of trips. We bought a second home in a nice place, and we use it constantly, and the boys use it constantly. My grandchildren use it. My life is back.
So you started to live again. Your
Absolutely.
energy returned, your strength returned.
Yes, and my ability to converse returned, and my interest returned.
Tell us about this conversing business. What do you mean?
I never had trouble talking, as you probably can see, but the problem was the conversations, they didn't flow. It didn't go A, B, C, D, E, where one sentence would normally follow another. it would start at one point and then go off on a tangent and then come back and then go away again. Or it would be very, very hard to follow what I'm talking about.
It sounds like there was a trifle mental confusion.
There was a lot of mental
A
confusion.
lot of it. And the testosterone did what to that?
180.
180.
We're having this conversation. I think it's flowing pretty well. I mean, that's exactly what's going on.
And what happened to you sexually?
Another 180.
That all came back.
Everything.
Um,
Even at my age. Now, my wife is 62, and I'm 65. Where she was more interested than I was at a certain point, now I'm more interested than she is. But she's cooperative, but that's not the point. The point is the interest is there, and the activities are there, and the attitude is there.
the problem is that she hasn't replaced her testosterone.
Well, that's we're not talking about her. That's
Okay.
her problems, and that's what she has
Right.
to do. As far as I'm concerned, my interests are there, and my abilities are there.
What happened with the weight and the diabetes?
Unbelievable. My my ABA1C went down dramatically. In fact, I believe you said that it's at a normal level at this particular point. It went down from like over 10 to below 7.
Hmm.
My weight, I lost 43 pounds. I went from weighing 277, 278. I now weigh, I'm in the 220s, the high 220s, but nevertheless the 220s. I don't have to go to the fat man's department to get fit, or call extra large to fit me anymore. I fit into regular clothes. It's not a problem.
So it made a big, big change in you. Just simply
Tremendous.
replacing your testosterone.
Tremendous.
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 Okay. Is there anything else you'd like to say?
I would like to say a couple of things, yes. To any, I don't know about for women because I don't know exactly what the proportion of, medically the proportion for women. I can just talk from a man's point of view. That my problem that I had was not confined to David. It was confined. It happens periodically to many, many people. And those people who find themselves in that type of a position, if they don't realize where the deficiencies are, and they don't see a proper seek the proper medical advice to correct the situation, they're missing a lot. And it's called your life, and you just you're going to go stay in the basement. You're not gonna. The elevator just won't. You'll be stuck in traffic. You're not going to move. It's that simple. And if you don't realize that, then you're making a huge, huge, huge mistake. You're going to get old very, very fast.
Without the testosterone.
Without the testosterone. With the testosterone, you're still going to get old, but it's not going to be that fast.
Okay. Thank you very much.
You're very, very welcome.
Thank you. Appreciate it.
My pleasure.